dentists say that 30% of their applied for treatments through authorization process have been accepted, but 70% have been rejected.
The Canadian Dental Association's president says in some cases as many as 7 in 10 claims for complex dental work through the Canadian Dental Care Plan are being rejected. Under the plan, more complex and expensive procedures need to be pre-approved before the work can begin. But Dental Association President Dr. Bruce Ward says providers just aren't sure what kind of proof is required to prove that the work is medically necessary.
The amount of evidence that it takes for you to submit to Sun Life is still a mystery to a lot of dentists, and that's why so many claims are being rejected.
That's not the only growing pain. Dr. Ward says some patients are coming to clinics unaware they need to re-enroll in the dental care plan each year, and others aren't aware that the plan isn't 100% free. Each province outlines in a fee guide how much procedures cost, but sometimes the Canadian Dental Care Plan won't cover it all.
So if a service costs $100 in the BC fee guide or the Ontario fee guide, and Health Canada and the Canadian Dental Care Program says they'll pay for $85 for that service, the patient's going to have to pay the extra $15.
Ward says to their credit, Health Canada is listening and working on the problems, and overall dentists are happy to see patients who otherwise can't afford dental care getting treatment. The Canadian Dental Hygienists Association feels the same, but still have their own concerns. For over a year, they've been highlighting a double standard in how hygienists are compensated under the plan. Through it, hygienists who work in their own private practice are paid a percentage less than if they worked in a dentist's clinic.
For some, it was maybe as little as 5%, 10%. In other provinces, and then depending on the service code for the work that was provided, that discrepancy would have been between 20, 25, even 30% in some cases.
Wells says in general, Health Canada is listening to her profession's concerns. As evidence, she says the plan substantially increased how much hygienists get paid in the 2025 fee guide, though the double standard remains. City News reached out to the office of Health Minister Marjorie Michel. In a statement, the minister's spokesperson says their government will protect the dental care plan. In Ottawa, Shaoli Lee, City News.